Hey guys, Happy New Year's, Happy 2023, and welcome back to another episode. Last week we talked about the exciting new concept of Easy Gel, which I said it's been around forever, PRP, PRF, but now I'm super excited to bring you Easy Gel, the latest and greatest when it comes to collagen and most importantly, all natural filler. So make sure you guys, after you watch this video, both go back to that previous video where I talk about all natural filler, and that's what I really mean, all natural. There's nothing in it except your own blood. So make sure you check that afterwards. But we're gonna go back to one of our most popular subjects is PDO Threads. For some reason this week, everything comes in bunches. So I had a whole bunch of consultations, a whole bunch of treatments on how do we do PDO nose or how do we do PDO Threads for the nose. But I also wanna discuss Botox, fillers, and surgery for this area when we come back. To alter the nose, you have a couple different options. You have surgical, rhino. You have liquid rhino, which is fillers. You have Botox to assist the area. And then now we have PDO Threads as well. Personally, my combination is Botox and PDO Threads, but there are limitations on this. I used to do fillers. I don't do fillers anymore. It's just a personal choice, safety reasons. And then if you do want to see, not myself, but a colleague of mine for fillers, you can reach out to us and then I'll send you to my colleague I work with in La Jolla if you want to do fillers as well. And we'll talk about the combination of fillers, threads, and Botox. But for me, let's talk about threads and how I encountered multiple situations during this week's treatment. For the nose, I think you have three main parts. You have the upper, which we call the radix. You have the bridge, which is also called our dorsum. And then you have the tip, and then down here as well. So let's just say the tip, the middle, and the top. With surgery, typically you're one and done. Also, the big part about surgery is I can take away. Meaning, if you have a big dorsal hump, or if you have a big bridge, or if you have a wide nose, surgery can slim everything down and reduce. Medical spa setting, we cannot reduce per se because we can't take away, we can't cut, we can't shave. What we can do is mask everything around it. If you think about fillers, if I had indentation here, I would just take fillers and I would blend in the small lines. For the nose, and I'll pull up pictures, but I'll just use myself as an example, but I'll pull up video and a picture of me doing threads up here with before and afters as well. If I had this bridge hump, I cannot take away this bridge hump in a medical spa setting. We have to mask everything else around it. So what we have to do is bring out the top portion of your nose to line up with the bridge. So now the whole bridge is more even. I can also bring out the rest of the bridge. So from the top of the radix all the way down to the tip of the nose, I'm bringing everything out. One, to slim it, and then two, to match that hump that I cannot get rid of. So I have to fill everything around it to match up with that dorsal hump to even it out. Let's discuss the pros and cons of this. My patient today, when she asked about PDO Threads in her nose, she was adamant. She's like, I do not want fillers. For safety reasons, I don't want fillers, but I want PDO Threads. What are kind of the pros and cons about it? Well, fillers, you can more fine tune with fillers. You can directly put the filler into the area of the bridge that is going to give you the best aesthetic outcome. For her case, she had a very prominent dorsal hump, but she wanted to do PDO Threads. So I gave her some pictures and I said, hey, this is our limitations of it. I have to bring out this whole bridge with this radix. Now, because the radix was so far indented, this was pushed way back, I said we have a limitation because your skin is going to overpower the thread. It's going to bend the thread in. Whereas fillers, I can keep pushing to push that skin out. So I said, let's undertreat the area. Let's put in enough threads where you get 70–80% of where you want to be. Go home, get used to your face, let the threads really fine tune that area and start building some collagen. In 2 or 3 months, come back and then we'll add some more. Another reason we go slowly because fillers, I can dissolve it, I can backtrack. It'll go away on its own. PDO Threads, once it's in there, it's pretty much in there. Yes, I could technically go try to find it, but it's very difficult. The other part is surgical. Now, if you're gonna go to surgery to take away threads, you might as well do surgery to fix the nose. So we wanna go in stages. Now, another pro of threads is I can actually physically lift the tip of the nose. Fillers, for you to lift, you have to bring everything out. So at some point you have a limitation. But threads, I can just physically lift the area as well. Now the cons pretty much have the same cons when it comes to PDO threads and fillers. The biggest con, and especially for this patient who spoke to me, was it can cause arterial occlusion. Now if I occlude a vein, if I occlude an artery, you're gonna cause other issues, blindness, tissue death, necrosis. So you have to be careful with that. PDO threads, while technically there is a possibility, it's a very, very low probability and much lower than when it comes to fillers. Now I want to discuss the actual procedure itself. So hopefully my team will put up a little box over here or split me half screen where you guys will see me doing the procedure from beginning to end. They'll splice in and out of it. But what I'm going to do is I'm going to take a look at the nose first. What are we trying to actually achieve? Are we trying to slim it? Are we trying to fix the bridge? Do we have a deviated septum? And what does the radix, the upper top of the bridge, look like? Now, I'm going to make a little insertion point right at the tip of the nose. For probably 99% of the patients, even more than this, you're only going to leave with one poke hole, and that's right at the tip of the nose. I'm going to numb that area first with just some lidocaine with epinephrine, maybe some bicarbonate to numb that area so you don't feel the poke. Next up, I'm going to take a little 18 gauge needle and I'm going to insert a little pilot hole right into the tip right there. Now, we can use multitude of threads. I have specialty threads specifically for the nose, and I have traditional barbs that you've seen me use to lift to the face as well. So I'm going to send a couple specialty threads up the bridge of the nose, and I'm going to slowly build that bridge and build that radix. So with every thread I send up there, I'm building the bridge a little bit higher, I'm straightening the bridge a little bit more, and I'm masking that dorsal hump. After I'm fully satisfied with here, and remember, we're going to undertreat the area, knowing that I want to undertreat because we cannot backtrack. You're going to come back to me in 2 or 3 months and we're going to add more. Now to end this procedure, do I want to lift the tip further? And do I want to support the columella? So through this hole, I want to send some threads right through the columella and end right before your mouth. And those threads are going to help lift, elevate, and support that columella as well, so there's less rounding on the bottom of your nose. And then lastly, if you're a person who animates, smiles, and talks, and your nose constantly pulls down, then what we're gonna do is we're gonna take some Botox, and we're gonna inject it right on the tip of that nose, and that relaxes the muscle that pulls down on the tip of the nose. And that's most treatments when it comes to PDO threads. So the procedure itself is pretty simple because I'm treating a very small area, but it takes a careful hand and it takes a careful eye to really understand, is it a thread issue? Is it a filler issue? Is it a Botox issue, a combination? And can we get you to reasonably where you want to be? And most importantly, has your provider actually talked to you about surgery? Have they mentioned to you, can you do surgery after you've done threads and fillers? If they don't bring up that concept, likely they haven't done enough of these procedures to appropriately treat you. All right, guys, that is another episode on PDO threads, another episode on PDO nose, and don't forget to check our previous videos. I'm super excited about Easy Gel, and I really want to introduce this to you guys. So we're one of the few practices in Southern California that's doing it. We're one of the few practices that actually has a trainer here, this guy. So come in, ask us about it. Don't forget we have Zoom consultations. We also have in-office consultations. So we do this worldwide. Reach out to us. Don't forget to like it, subscribe, and hit that notification icon, and then share it to everyone else you think would appreciate these educational videos as well.